Hello, everybody. I just want to check that everybody can hear me. Welcome to this webinar. And this is a collaboration between NHS England and Improvement and the National Network of Parent Carer Forums and Contact on admission avoidance for children and young people with learning disabilities and autism. Moving on to the next slide. Just a few housekeeping points for those of you that have joined us. If there is a technical hitch, please bear with us. Those of you joining by PC, laptop, tablet or smartphone should now be able to see this introductory slide so that you're very much here in the webinar. So we're hoping that's the case. Again, thank you for joining us. And moving on to the next slide, please. As there are a lot of attendees today, it's just not practical for verbal questions to be taken. Therefore, everybody attending will be muted throughout. If at any point you do have questions, please use the question mark icon on the GoToWebinar toolbar on your screen. It is literally a question mark. So that's what you need to click and to add your question. We will try and answer as many questions as possible if it's relevant as we go along or towards the end if there are outstanding questions. Just be patient, thank you. The next slide, please. Just to recap, this webinar is the focus is on avoiding mental health hospital admissions of autistic and learning disabled children and young people up to the age of 18. And it's it'll be looking at excuse me, the actions that are happening around this area at the moment, but also it's primarily a co-production opportunity for interested forums to get involved in helping to bolster this work, this really important area of work. So that's why we've invited you all here today. Could I have the next slide, please? Just taking a quick look at the structure. Oh, sorry, who's here? Yes, the people who will be presenting this slide today are Kath Brumfield, who's the steering group, Northwest Steering Group member for the National Network of Parent Care Forums. Myself, my name is Amanda Elliott. I'm the Strategic Health Lead for Contact. We've got Phil Brayshaw, who's the Admissions Avoidance and Commissioning Lead for NHS England's Children and Young People team. That's the Learning Disability and Autism programme. We also have someone who's probably very familiar to many of you, Mary Busk, who's the Senior Family Care Advisor for the same team. And we've also got Carrie Sykes, who's the Health Inequalities and Health Improvement Lead for the Learning Disability and Autism programme for children and young people at NHS England. So it's very much a collaborative effort here and, you know, very much in the spirit of co-production. Thank you. Could we have the next slide, please? A quick spin through the agenda. We'll be just reminding ourselves of the NHS long-term plan commitments, particularly around this area of work, about building the right support and the commitment to building stronger community services, a little bit of reflection on what some of the jargon means and where co-production fits in to these long-term plan commitments. We can't really get away without looking at the impact of COVID-19 on our families, particularly the at-risk children and young people in this group, and what's been done so far to sort of recover services and the work that's happening already around admissions avoidance. We'll be looking at some of the key planks of admission avoidance for our children and young people, which is dynamic support systems and registers and the care education and treatment review process and other help that's available. But fundamentally, this is about you guys out there at the forums and crucially, you know, next steps, what's the opportunity to get involved with this work and bid for some funding. And there'll be an opportunity for outstanding questions at the end. Thank you. I'll be leaving you now for a bit and handing over to, is it Phil who's next? We've got.
I think it may well be.
Yes. Okay. Thank you. Phil Brayshaw from NHS England. Thank you.
Okay. Thanks very much. For I think I've been asked along to talk to you today about some of the commitments that we've made in the NHS to children and young people with learning disabilities and autism and their families. And so the place that I thought would be a good place to start is the NHS long-term plan. So for the first time, the NHS has really put children and young people with learning disabilities and or autism right at the centre of the improvements that they want to make to services and make sure that families get the right support and move along. So I'm gonna talk a little bit about some of those commitments and really put them into the context of avoiding admissions to Tier 4 mental health hospital, and we'll talk about that as we go along. So one of the key commitments that we've made is that we will reduce the number of children and young people in Tier 4 mental health hospital. Now, that's not to say that we will stop children and young people with learning disabilities or autism going into mental health hospital if and when that's the right thing to do for their treatment. This is about preventing admissions that are unnecessary or inappropriate or avoidable, where children and young people could stay at home and receive the care and treatment that they need in an environment that's more comfortable, keeping in contact with people that know and love them, and using services again that are known and make sense to them. So this is about providing the right care in the right place at the right time. Core to that is what we talk about at the bottom of the slide, which is making sure that the right support and services are available to children and people and their families. And we're working with children, young people and families to make sure that that support is the right support and provided in a way that makes sense and is helpful. So as I said, lots of national guidance at the moment describing the types of support and services that people have told us are useful, and that's what we're working to put into place through the long-term plan.
I think many of you may be used to some of this terminology, but we wanted to kind of give everyone a level playing field, so we're just reviewing it really for you. So
one of those policies called building the right support, and I know that this is a really useful way of thinking about it. I think it's about making sure that children, young people and their families are at the centre of the support and services that they receive from the NHS and from our colleagues in education and social care. It's to make sure that children and young people have the same opportunities as their friends, and that they have the right care and support to meet their aspirations and be successful in life. A lot of this document talks about the choice that people should have, and as hopefully we're demonstrating through this webinar, we see this very much about working in partnership and co-production with children, young people and their families who use the services that we commission and provide. And the next part of this model, and again, it's really central to thinking about why children and young people are often best receiving care and support in their local community, because it's about building on that. It's not about taking children and young people outside of their home, outside of their area for specialist support, and losing all of the support that would ordinarily be available in communities. It's about building on that. And so it's about making sure that children and young people can receive the types of services that everybody else can receive, again, in a way that's adjusted for them, and then building specialist support on top of that. And so, again, from I guess it's one of the reasons why it's important for us to think about reducing hospital admissions. So, there are two things really that I'd really want to point out. So the first one and again, I'll keep talking about this, it's about reducing avoidable admissions to mental health settings. When children and young people are admitted to mental health settings, it should be for the shortest possible time. There should be a clear plan behind that. And what we want to move away from, again, where it's not the appropriate thing to do, is placing children and young people outside of their home area, whether that's around residential schooling or specialist healthcare. So reducing avoidable admissions, a really important commitment of the long-term plan. Second commitment is to increase our investment throughout the NHS in terms of those types of services that people receive, that children and people and families receive when they need additional support. And so that's thinking about intensive support services, crisis services, and again, the long-term plan talks about forensic services. So supporting those children and young people who may have got into trouble with the law. The third part it talks about here is improving the quality of inpatient care and discharge planning. But what we are saying is that when children and young people are admitted to hospital appropriately, they should receive the type of care and treatment that you would expect.
I think what we used to see historically was that people would be told they're going in for 12 weeks and it would be an awfully longer time. And that what we knew, just to summarise again really, is that if they'd been given the right support before, most people wouldn't need to go into a hospital setting. And so I think the NHS plan has really reflected well what parent forums and other parent groups were saying really clearly from their experience in that system.
Okay, and I am aware that there's a questions box. I can see some questions and things, but I can't keep track of those as well. So hopefully I'm pitching this about right. But do put questions in the box, and I'm sure that we'll pick them up as we go through. Next slide, please, Carrie. Okay, so this is those commitments in full. So I'm not going to read those out, but those are there for you to see. I think the slide pack is shared, is it? Is that right? But again, this is all available on the NHS England website, and I would encourage you to take a look. So that is around reducing admissions, increasing personal health budgets, increasing investment in intensive crisis and community support. The next one, please, Carrie. So just some background, and we had a conversation around this when we were planning this webinar, because these aren't really our words to define. I think that these words make more sense when children, young people and families describe what this means. That we're working again with people to really understand this. So the commitment is to improve support in this area. What we need to do is work out what that support would look like if it's going to be most helpful. Intensive support we think about as that type of support, specialist support, when maybe things are not going well, and so it's additional support, often around behaviour, mental health, and other challenges. Crisis support is so we've worked with families already to try to start to explore this, and this idea of breaking point comes up again and again. So it's when things are feeling harder, when it's becoming difficult to cope, and when things feel like they're at breaking point. And that might be stress within a family. It might be that a service is just not providing the right type of support for you and your children and families, that's leading to things feeling as though they're going to break down. And I think this is an area where we found it quite difficult to respond in a way that's helpful to families. Forensic we've touched on, and this is about relating to those children and young people who might come into contact with the criminal justice system or be in trouble with the law. And again, what we're seeing, I think, is that quite often, depending on what help you're offered, how your needs present themselves, you might go down an education route or a criminal justice route or a mental health route, and none of those might be the right route for you. So it's about making sure that those children, young people and families, when they are struggling for whatever reason that may be, receive the support that they need, and that support is in the community. So that's about receiving the support where you live or close to where you live. The next one, please, Harry, and I think this is my last one. Before I hand over to Carrie to take over, I thought by this point you may have heard enough from me, and just really key to keep reminding ourselves that at the centre of these commitments in the long-term plan is co-production. That this is about working with people who use services, working in partnership who use services, to drive those services where that are most helpful, most meaningful, and provide the types of support that helps rather than hinders a family in crisis.
And I suppose for me there, it's about embedding that co-production, what forums are really good at understanding real co-production means, not just the word really. So we're having some, you know, extensive conversations around that, as you do locally. We also nationally do that, and regionally.
Okay, thank you, Kath, and I will hand over to Carrie, but I will stay around and maybe even butt in, as I have a tendency to do.
So over the last 6 months,
at this point, sorry, very quickly to say that there are a few questions. There's a very specific question about CETRs and the provider collaboratives. Whoever's covering that at that point, would they be able to answer that question about what's happened to the CETRs in the provider collaboratives and who's responsible? Will it be the NHS England, or will the collaboratives be sorting that out themselves? So I'd be grateful if someone could address that when we hit that slide, please.
so I'm going to just kind of go through what the impact of COVID-19 has been and some of the changes because of that. So we know that there has been a huge impact with coronavirus, and that children and young people with learning disabilities or who are autistic and their families have had huge impacts from education, from health, from disruption changes to services. And we also know that some key NHS staff were redeployed to respond to other frontline challenges, which also then impacted on kind of children and families. We've moved into recovery planning for phase 3. And again, what we're trying to do is really focus on and work towards our commitments in the long-term plan. So we're looking at continuing to commission and deliver high quality support services, and also working on interim measures to make sure that we avoid a potential surge or increase in admissions of children and young people, especially at this point now that kind of we've got to consider things like local lockdowns and the tiered approach to different areas, which can be confusing for anybody, never mind children and young people. We've had a number of different admission avoidance responses. What we're trying to do is make sure that commissioners and NHS providers are kind of becoming increasingly vigilant around children and young people with learning disability or who are autistic. We are issuing guidance to NHS staff, particularly those who are working in key services and supporting children who have got education and healthcare plans. We're doing a really specific piece of work around the dynamic support register and dynamic support processes. And I know that these were previously sometimes known as at-risk of admission registers. And we're re-emphasising the need for the care, education and treatment reviews to take place in the community before admission, because we know from the CETRs that we've done so far that in a huge number of cases, having the CETR does lead to an avoided admission. And we're kind of giving advice to regional leads about these changes, and we're asking for further support so that each region can really focus on admission avoidance. Would it be appropriate, Phil, at the minute, at this slide, to kind of answer about the dynamic support register and CETR in terms of the change to PCSs? Or do you want to leave that till the end?
Shall we come back to questions at the end? I think that would make sense. Yeah.
Okay. So just a little bit, in case you're not kind of fully up on what dynamic support systems and the dynamic support register are, and really it's a way for a local authority and a CCG to understand who are the children and young people in the area that are autistic or who have learning disabilities, who are these families that may need extra support. And it's really key to kind of, for local authorities and CCGs to understand that kind of who are we working with and who are we here to support before those children and families get to a crisis point, before those children and families really need the intensive support. And we really see this as really, really important for reducing reliance on inpatient care for children and young people. And at a minimum, the dynamic support register should have all children and young people with a learning disability or who are autistic and who are at risk of admission. It should have kind of a way to identify those children who are likely to become at risk of admission. And it should be there to flag up early, this young person is probably going to need a care, education and treatment review, so that can happen before any admission. And the register as well can be developed so that it links to a full range of support and services. And it's a really key way for CCGs in local areas to hold all of that information in the one place so that they can see straight away, this family has this need, or we've got this support that might be useful for that.
And I think it's worth mentioning here for forums that there is quite localities have approached this in very different ways. So as always, it's really useful if you weren't aware of this to get aware of it, because I think it's quite a big role for forums as we move forward in making sure it's quality and that they're catching the children and people we know that are sometimes missed, who perhaps don't meet other services but we know are in crisis. So it is a really good idea, and I think when it works really well, we've seen it be a real strength in stopping people going to hospital unnecessarily. Thanks,
Kath. So yeah, as I mentioned, one of the key things that the dynamic support register will do is allow local areas to see who is likely to need a care, education and treatment review. And that is it's a meeting about the child or the young person, and when they're at risk of being admitted or in crisis or currently an inpatient in a mental health hospital or a learning disability hospital, they will have this meeting, and it's primarily to avoid admission or to facilitate discharge from hospital in the shortest time possible. And it's looking at what does this child and young person or their family need so that this child doesn't need to be in hospital. Usually the meetings are face-to-face, but obviously the challenges during COVID have changed that, and the majority have been happening virtually. So they've been happening in Zoom meetings or team meetings. And community CETRs have always been a really vital part of the local response to admission avoidance. And we can see that now it's even more important that we are having these CETRs quickly to avoid any unnecessary admissions.
And I think the other important bit for forums to know, if they're not already aware, is that there's always an independent panel. So there's a chair and there's an independent expert by experience, that's somebody with lived experience that is either a parent, carer or family member, or a person with disabilities themselves, and an independent clinical lead. And for me, that's one of the big things that makes a real difference in the CETRs, is that you change the culture, because it's just like when we're in a room, we change the conversation. It's the same thing, but on a very individual level, and can be really powerful for making sure people are looking at the person and it doesn't become too system focused.
That's right. The independent expert by experience is really key, because they're not there to think about what support do we have in this area and how can we make that fit this person. They're there to think about actually what this person needs is this. Even if it's not available in the area, they can really focus on what is the best support. So in thinking about kind of what other support is available when we're trying to make sure that children and young people are not admitted into hospital unnecessarily, there are a couple of other kind of avenues that are open. So there are NHS urgent mental health helplines, and these are kind of helplines that are there for people of all ages. So they work with adults as well as children and young people, and they're there so that they can give you 24-hour advice and support. They're there with mental health professionals on the line, and they can do an assessment over the phone to help you decide on what is the best course of action kind of following the phone call. And in the slide set that you get, this is a clickable link so that it will take you to the page where you would be able to find your local mental health helpline, because it's different in every area. And the other thing that is around because of COVID is the NHS Volunteer Responders scheme. So this was set up kind of fairly early on once COVID had hit, and it's lots of people volunteered to do lots of different things for families. So if you can't go anywhere that's really busy, if you need help with shopping, if you just need somebody to speak to, it's there for you for there. And I think particularly it was used by people who were self-isolating or who couldn't physically go anywhere. And again, the number that is there to kind of give them a call and arrange that, and kind of as kind of families or children, you're like with children themselves can get support from this, but you just need to call the number and they'll get that set up. And this is going to be running at least until the end of December this year. And obviously, depending on the situation with COVID, it may well be extended into 2021.
And Carrie and Phil, we did discuss this when we were planning the meeting. Please do feedback if parents are using this service, just to make it as disability friendly as we possibly can. We would welcome your feedback on that. Thank you.
Sorry, can I just chip in? We're starting to get quite a lot of feedback and questions. I have to apologise, I can't always see who the questioner is. There are a couple of specific questions around the criteria used for a young person being identified at risk for on the dynamic risk registers, and this being referred to as varying. Is it decided locally? They're very specific questions. There's also some less questions and more feedback. Someone has pointed out that Hertfordshire's emerging findings from CETRs show that breakdown in educational placement is the most likely precursor for admission. Again, I'm really sorry, I can't see who's submitting these questions. The other thing to be aware that you can't see each other's questions. These are all being submitted to the panel and the administrators, so apologies for that, but it just helps us to manage it. And there are other feedback about the CQC restraint report as well, and asking whether NHS England would back the findings.
I think, Amanda, I think it's worth saying as well, I'm struggling to see questions. I could see them when we practiced, and I'm not seeing them now. But we will definitely all get together and respond to those questions and send a sheet out covering them. So if we aren't covering it right now, please let us. Just go back to the dynamic system. I was an expert by experience many years ago, and still am, when our frustration was that we could see some of our children and young people had been heading towards crisis and nothing had happened. So the dynamic system came out of a plea, really, that many of us could have told people were heading towards a crisis much before they were. And I know Phil and Carrie will fill in the technical bits, but I just wanted to share that part of our motivation was so that local systems didn't dictate who they knew about, really. So I think we've a way to go, if I'm being honest, on the dynamic systems, and we're hoping you will help us with that as we come on to the next future slides. But I think it's worth saying that some areas are saying you have to have an EHCP. I would challenge that, and I would openly challenge that. The whole idea is that what we know through CETRs is that many of our young people don't receive services, don't have an EHCP, haven't got any additional support in terms of a budget or activities outside the home. So places are trying to do the best, but they're also making them very local, and we've got to start a culture and a discussion where forums do what forums do best, which is to challenge that as well. And this is the start of that journey with NNPCF and NHS England and Contact to really try and get this conversation going within forums. So I hope that slightly answers it. I'm sure Phil and Carrie might have some other things to say.
Yeah, amazingly, and this is amazing, I can see the questions. I've worked out how to work the box. And for those of you that know me, I've surprised myself. So I just wanted to provide a little bit of context on what we're talking about today, because I can see that lots of the conversation relates to lots of the challenges across across the NHS and other challenges in terms of accessing the right support and service both in the community and inpatient care. So there is lots and lots of work going on across the Learning Disability and Autism programme in terms of improving the quality of dynamic support registers, care education treatment reviews. Getting a little bit of feedback. I don't know if someone maybe needs to go on mute. Lots of work going on about in terms of understanding and improving community services. We're working with the Criminal Justice Service and Health and Justice in terms of providing some very specific trauma-informed community support for people for children and people vulnerable in terms of coming into contact with the criminal justice system. And actually, the overlap is one that we've noted, and so those same children that might end up in a mental health hospital without the right support and services may well end up in contact with the criminal justice system as well. So we're really working together to try to understand that and put some specific supporting around that. So there are lots of things going on in lots of these different areas. I'm more than happy to come back and talk about any or all of those at a future point. In terms of today, and I think my colleague Mary is going to go on and talk about the ask and offer in terms of admission avoidance. We're talking about something quite specific. So I think as Carrie has really ably set the scene, that we recognise that this has been an incredibly tough period of time for children and young people with learning disabilities or autism. In terms of the pandemic and the lockdown restrictions, the impact that that's had on in terms of services and support that's been disrupted, and the extra pressure that's created for children, young people and families. What we don't want to see is an increase of unnecessary and inappropriate admissions as a result of that. And so what we are saying is that in addition to support usually on offer, there are some other offers of support in terms of the crisis support line and in terms of NHS volunteers. What we really want to do, and we're working with local areas to do in parallel to this is really strengthen the dynamic support register. So we are telling local areas, you must know your children and young people at risk of admission. You must know those children and young people who are likely to become at risk of admission if they don't receive the help and support they need right now. And so we're having that conversation with the regions of the NHS. We are having those conversations with local commissioners and providers and being very clear that as a minimum, you should be doing this. As Carrie said, community CETRs are vital in terms of avoiding unnecessary admissions to hospitals. It's something around, I think it's 82% of people who have a community CETR avoid going into hospital and receive the right support and care at home or in the community. And so there is something about making sure that we help local clinical commissioning groups and local authorities to understand the population of children and young people at risk, even when those children and young people are not known to services. And there is something about making sure that those children and young people receive a CETR, care education treatment review, before a decision to make an admission is made. And so those are the two things that we really want to focus on today. And what we're asking is how can how can the network of parent carer forums support that work so that those dynamic support registers are more reliable, more likely to identify those children at risk of admission, and are more likely to offer CETRs. And so that's just to frame some of that. But as Kath says, any of the other questions that relate to any other areas of work that we're doing, I'll be glad to kind of pick up and draft some response.
And we're moving on to Mary, who's now going to tell a little bit more about what we would like to do with National Parent Care Forums and how we would like to work together.
Yes, so we're delighted to be able to be here today, not just to explain to you about the work we're doing nationally, regionally and locally, but also to say that we really need your help. And so we have an ask of you today as NNPCF regions and local forums, and I'll explain a little bit more about that. If you move on, thanks, Carrie. So I don't know, Kath, if you want to add to this as well, but we really understand and appreciate the value of your role as a strategic co-production partner, regionally and in your local areas. So we know how important and how hard you work to co-produce policies and solutions in local areas. We know how much and how hard you work to make sure that families know how to get help and support, including through the local offer. And so we very much want to help through an offer of additional funding to help build your capacity to help us in this area of admission avoidance. So I don't know if you'd like to add anything here, Kath?
Yeah, I think for some forums, they will have been working around these areas, but for other forums, this will be all quite new, and that's absolutely okay, because sometimes the children, young people, this piece of work affects are quite tiny for a forum's membership. And sometimes you have those individual cases that bring them to your attention and you're quite informed. So again, we've tried to go back to some basics on this really. So if you want that detail, as Phil said, we can provide more detailed answers to everybody. But I think Mary's right. We know forums are a good strategic partner in their localities. You keep them real, you keep reminding people of what we're meant to be doing and how, and that's really, really effective. So that's part of why NHS England want your support today.
So we have actually issued an invitation to NNPCF regions to submit proposals to us for how you can or would like to spend a little bit of money that we have. We're actually asking for this money to come in, not through your NNPCF regions as such, your 9 regions, but actually reflecting our NHS England and Improvement regions, which are 7 regions. And so that will mean that for some of your regions, you will need to work with each other and to submit your proposals reflecting the NHS England and Improvement regions. That's important to us because, as Phil said, you know, our dialogue in the national team happens through our regions. And so it's vital that you understand and know, as local forums and as you know, through your regional work, I know you've got really strong regional networks, who the people are in your regions to speak to, your children and young people strategic leads. And I know people like Kath and others will know who those are. If you don't, it's about sort of building and strengthening those relationships, and really giving the chance for you to think as regions, you know, individually, what it is that would make the difference to you to help us make a difference to families and young people on the ground. So the proposal that we have is, and I'll come on to the timetable, but this is between now and the end of March next year. We've asked for, you'll see on the timetable, if you could write your feedback and learning by the end of April next year, because we really want this, I very much hope, to be the start of an ongoing dialogue and joint work, because we know that, you know, not just working, as Phil described, through, you know, our NHS England colleagues, but we want to work with you because of the influence you have in local areas. And some of you may already see and understand the links with special educational needs and disability, but in our national programme, all of our governance is basically, we sit alongside the Department for Education, the Department for Health and Social Care, and other national partners, including the national network. So our national governance reflects what you will find as your local and regional governance. And so it's partly also sort of appreciating, whereas, you know, you might, you know, and people might think a lot about SEND, that this is a very particular and important group within that community who need a lot of help and support to have really good lives. So the proposals that we're asking, the regions, the NNPCF regions, reflecting the NHS England and Improvement footprints to set out, are how you can help to, or how the money, which is £5,000 up to £5,000 per region, that money could be used by you to help develop your understanding of dynamic support registers, you know, to ensure care, education and treatment reviews are well understood, you know, knowing about where to go to get pre-crisis support, highlighting themes and issues that lead to crises for families, and, you know, using your strategic co-production role to work and to work out how best to influence that in your local areas. Helping to look at and think about gaps in provision. So obviously that will be very much tailored to local areas, but thinking about how really you as a strategic co-production partner regionally and locally can sort of think through these issues, and hopefully also by sharing knowledge and learning and building your capacity through this work, will maybe make and help that dialogue within your local area, knowing who to speak to about these issues, knowing who to direct the questions to about dynamic support registers or care and treatment reviews, and knowing, you know, the things to be asking for and looking for, and also understanding and ensuring the needs of children and young people and families from all backgrounds, including race, are considered. We know from the work of Contact, for example, Caring More Than Most report that I refer to an awful lot, that, you know, families suffer additional multiple disadvantages even before COVID, from poverty, from not being able to work because of the caring responsibilities. We know many families don't have transport, and we also know, you know, that reflecting other areas of protected characteristics like race, that families may suffer even additional disadvantage, so perhaps being directed down, mental health and not autism pathways, or being directed more into the criminal justice system rather than having good lives, being in education, having really good outcomes, which is what we want for everybody. So something about understanding the particular challenges for different groups and how those can be supported and dealt with, and any potential sort of bias, in relation to different groups. I know just from my own background that, for example, I know sometimes families from Asian communities might have been told, you don't need help because you've got wider family connections, and that's obviously not acceptable. So it's these little things that can mean that particular families in particular groups, and including poverty, will really struggle, and we need to be their voice and really help them. So as I say, we've got up to £5,000 per region. It does reflect not your NNPCF regions, but our NHS England and Improvement regions. And that can be spent to support those deliverables, but it's very much for you to co-produce with your NNPCF regional leads in your forums what it is you would like to do in terms of activities and events over the next coming months. If you're moving on, please. So I'm sorry this slide's a bit small, but the templates and bid documents were issued earlier today. They've been sent to your NNPCF regional leads, and we've been in discussion, with them in developing that specification. We're obviously happy to help with any questions you have about that. We've given, and we know how precious and busy you are. We know we've got the half term coming up. We wanted to give you, time, a month to develop and think about what you would like to do. So to the 30th of September, we will then quickly turn around the evaluation of your proposals. We need to do this, because that's part of our governance. And really, we are looking to you then to put in place your plans and proposals from the beginning of December until the end of March, and then subsequently to let us have a note or report. We're not talking 100 pages, but a summary of your findings to help influence our policy development and our learning, and to think about what we might do in the next financial year in relation to work like this. So I don't know if you want to add anything, Kath, to that timescale.
As usual, NHS England timelines are always pretty tight, aren't they? But I think Mary's right. We wanted to try and give, the deadline, or it was released today, and we wanted to try and give you an opportunity to have some time to think about it before you actually have to do it. And I think with Contact and Amanda and your NNPCF reps, it's about having a conversation about how you might want to do that regionally to fit in. But what we know is, many of us watch time and time again how the system doesn't work for some of our children and young people. This is something we're strong on, and it's just about understanding the dynamic systems better, CETRs, so that our membership can actually be aware of them as well. So we're changing that culture, hopefully, as we move forward.
Yes, and I think, and just I think hopefully as well, by supporting you in this way, it will support and build capacity as well in your local forums, so that you can do this work collectively through your regional structures and help each other to to all be to understand where the particular needs of your region are, your local areas, and to move from that. And I know as well, I know Isabel Garnett's on the call today. She's on the webinar. I've just had a message from Isabel. So, some people like Isabel have delivered training. We've commissioned Isabel to deliver training to Sendayas over the last year. And certainly we'd be very happy to introduce, Isabel to the National Network Regional Lead, so that she can share and perhaps, work and support this as well as, other people, like we're going to hear from Amanda shortly. Sorry, Phil, did you want to add something?
I was just going to say as well, just to help with the context of it a little bit. In terms of the timescales, I think what we're looking to do here, so again, thinking about the impact that COVID has had, wanting to prevent a potential surge in admissions, we were keen to do something really quickly around strengthening dynamic support registers and making sure that people had CETRs. To me, those are the two things. And so I would be particularly looking for bids that focus on that. How can you make sure that children and young people, or how can a parent carer forum help to play, you know, to make sure that children at risk of admission are known on their dynamic support registers? So I'm thinking of those families that are turning to parent carer forums and saying, I don't know what to do. And it's that if they're not known to services, it might be difficult for services to make sure that they get or local commissioners to make sure that those families get the right support. So I wouldn't try to solve the world. I've noticed a question from Jackie Sherlock saying that 5,000 is not very much. I don't think this is about reinventing anything. It's about looking at how parent carer forums can help us to embed some of the work that we're doing and make it most useful for families in their areas. So the two challenges for me is making sure that children and people at risk of admission, or who may become at risk of admission to hospital, are known to their clinical commissioning groups through their dynamic support register. How can forums support that? And it might be bringing in some training for themselves around dynamic support registers. It might be around supporting some local workshops to work with commissioners or providers around developing dynamic support registers that are maybe more intuitive. And then the next part is around how can we make sure that children and young people who need a community education treatment review, because an admission to hospital is likely, gets one. And so that might be around parent carer forums, supporting those families to request a care education and treatment review at a point of crisis. It might be doing some strategic work with local partners in terms of making sure that parent and carer forums are empowered to request support or become what I describe as credible referrers, in terms of either making sure children and young people are on the dynamic support or receive a care education and treatment review, so that when as a parent carer forum you're saying, this is a person, this is a child or young person that's likely to be admitted to hospital if you don't do something. Then it's about how do we get you into a position as local parent and carer forums where that's going to be taken seriously, heard and responded to. And again, that might be around bringing in training to a local area. It might be around workshops with partners. It might be around something else that you want to put forward in your bid. But to me,
I think the credible referrer is a really important point for parent forums to think about. So as a strategic partner locally, how can you be part of that? And I think that should be part of what you're thinking of as you move forward in your ideas for a bid.
Yeah, and I think Phil's right. I mean, I think hopefully, because this isn't the first webinar we've had, there are a series of these. I've been involved in others with Marunal about the long-term plan and building the right support and the commitments for children and young people. So I think we've come back to you here today to talk specifically about admission avoidance in the context of COVID, and how we must all do our absolute best to make sure that children and young people get the right support in the community, you know, are known to local areas and services on dynamic support systems, you know, get the care education and treatment reviews, which have always been the policy, but now more than ever, we must endeavour to do our absolute best collectively together with your help to get, you know, to make sure that every child and young person has the best chance and gets the right help in their community, which is where they should get it. Okay, so I think moving on.
So just in response to the last question that's come in, will our CCG know this is something we're allowed to be involved in? So we're talking to the regions of the NHS and asking them to talk to their local areas around the range of work that we're doing around this, because this is one part of it. We're also working with other services and other voluntary sector partners in terms of this admission avoidance work. And so, yes, we are sharing with them that we are working with the National Network of Parent Carer Forums to make sure that their voices are heard in dynamic support registers.
So Amanda.
Hi everyone. Yeah, for those of you that don't know me, my name is Amanda Elliott. I'm fairly new to Contact. I'm the strategic health lead, and a big part of my role is to provide a resource and help and support to parent carer forums and the regional networks. And this is an exact example of where I can help build your capacity in terms of applying for these bids. We know it's a really tight time scale. Looking at that, you need everything in by the end of November, and if you need help, I'm here. My contact details are on these slides, but I'm sure these slides will be sent to you as well, so you'll have them. And I work Monday, Tuesday, Wednesdays, though if you email me and can't speak to me or inside those days, I can be flexible as well with a little bit of notice. But I'm here for you, so please use me. And yeah, so that's just really some help if you need it. Thank you.
I'm sure you will get some emails, Amanda, because I know my region probably would be really keen to talk to you. So this is a resource that's really helpful for us to try and formulate what we're going to be asking.
Yeah, no, that's great. Can I just apologise for not being able to see the questions and responding properly? So we may need to go through any that we've missed at the end, if that's all right.
Absolutely.
So this was just really a recap for who our Children and Young People regional strategic leads are. I know that your NNPCF regional leads will know these people. I know some of you, for example, in the Southwest, are on daily telephone redial to Graham, and similarly in other regions. But I think part of the work is really in sort of building these networks and making sure that you know, at a regional level as well as a local level, the importance of admission avoidance is understood, and that families' voices are heard. And I think we have a few minutes left for questions. So I think I've been on webinars before, and we will very much be doing a Q&A for you, for those that we can't answer. And I don't know, Phil, if there are others that you can see being so technically able that we could maybe cover in the last few minutes.
I think the majority of questions I can see are ones that we're going to need to take away and have a good think about. I can see that some areas are already in conversations with local health leads, and so there is something around. You know, I guess it's an important piece of this work that if you're working with local health colleagues and they are not aware of this work or not engaged in this work, then it is a useful prompt to start those conversations. And there is an offer of the funding to support some of the work that might result from that. And so I think it's a good place to start with your local CCG lead around children and people with learning disabilities or autism, to make them aware that there is this offer, and to ask if there's a scope to do something between you. I think that would be a really good way of going forward.
Yeah. I think last year at conference, it was really clear for NNPCF when Lorraine was talking about who are the areas who still don't have a great relationship with the CCG. For me, part of this work's really important for reminding them we are strategic partners and we do have those roles to play within. So for those of you that have great relationships, that's really good and it will strengthen that. But for those of you who still don't quite think their CCG gets there around forums, this is really helpful because it's coming direct from the national team to help us try and help them get better at those avoidable admissions. And, you know, again, for me, I think the really exciting thing around what Phil's talked about today is that idea that we could maybe highlight families that maybe are getting missed in the process. But it's the start of a conversation, as Mary said.
So I just want to, before we move on, we've got a final slide that Amanda, I think, will finish on. But just to thank you profoundly for joining this webinar today, for your commitment, for your hard work and dedication. It's deeply appreciated. I don't know if you want to add anything, Phil.
I would absolutely agree. Thank you all so much for your time and for listening. for your questions and comments.
Yeah, thank you, everyone.
I just wanted to add that the slides and information will be sent to you. The specification for the bid has already gone out to the regional networks, and obviously there's a recording of this webinar, so you'll be able to go back over to slides. There's been some great comments about, I think one from Isabel saying people need to think creatively, and I think the idea of forums being taken seriously when they bring to the attention of the local authorities families that are falling through the gaps and at risk of admission it's about understanding that the forums are serious and they need to be taken seriously, and any bid that reinforces that would be great, I'm sure. But again, I'm here for you to help you if you need them. I think in terms of leaving the webinar, also the recording of this webinar will be on the contact website in the next couple of weeks, and also some more news information. So thank you very much for attending today. Everyone's been brilliant, and apologies you couldn't see the questions, but they'll be reflected in the feedback that you get. Thank you.